Hello, everyone. Welcome. My name is Katharine Martinez. I will be the instructor. I really hope that this helps to kind of guide you and lead you to a better understanding of what a hygienist working in a hospital setting, specifically pediatric oncology, looks like. There's a lot of different variances into the different settings that you might work at, whether it be oncology clinics or whether it be the hospital setting. But I think this is going to give you a good broad overview of what it's going to be like to work in pediatric oncology, if that's the route that you choose to take within your career. But I wanted to kind of jump on here and just give you a little bit of background about me, your instructor, a little bit of what I have a lot of hygienists asking me, kind of what my role entails, what do I do, how did I get there, do I have any other further degrees or anything else that kind of helps to push me forward within this role. So my background is I am a registered dental hygienist. I have been doing dental hygiene in pediatric clinics, general dentistry clinics since about 2011. I kind of stopped doing clinical dentistry when I had the opportunity to follow my husband over to Ireland, and we did an expat assignment over there. During that time that he was doing that expat assignment, I was unable to do any clinical dental hygiene because they didn't want to sponsor a work visa for me to go over there and do clinical dental hygiene. So I decided at that time that I would try to continue my education and pursue an Master's of Public Health completely online. I did that through New Mexico State University and did everything online for that Master's of Public Health. And so when I was finishing up that degree, I also was in the transition period of moving from Ireland now over to Oregon. And in Oregon, I started working again in the clinical dental practice, working in a general dentistry practice, and really just kind of felt that clinical dentistry wasn't for me. I didn't like the hustle and bustle of it. I felt undervalued. I felt underappreciated. I um, I just knew that there was something more that I wanted to do within my career and within my span. And, doing a little bit of that public health, it really um, reinvigorated me to see what else might be out there. So, as most of you might know, going into that public health route is a very, very difficult. It's difficult to get into that unless you know somebody, unless you meet certain specifications, but it's hard to kind of work your way into that area and that field. A lot of times, even though, you might, have like the desire and the passion, whether or not your resume shows it, if you're just done clinical dental hygiene, it's not really going to set you up for success, whether it be like program planning or anything like that for public health. Again, also looking at public health is a lot of times public health is a huge pay cut. So when you're looking at public health careers, a lot of times you're saying, I don't know if I can take a $20 an hour pay cut to move into public health. Really, a lot of us hygienists are wanting something that's kind of favorable for both clinical and both public health and something that we can do that's not going to be too much of a pay cut. So that was kind of where I was at is I wanted something more in my life. I wanted to do something more that was going to benefit and help a lot more people. I just didn't know how to get there. So I started applying myself thinking, oh, I have a master's degree in public health. This should open the door for me to kind of get my foot in. And it really didn't. I went on these interviews and they just told me, you don't have the experience that we're looking for. You don't have the knowledge base that we need for this type of role. I'm like, I'm a quick learner. I can do it. And they're just like, no. So I decided to kind of go back and reflect on what I did have on my resume. There's not a lot. I had, you know, restaurant business from hostessing, bartending, serving, and then I had my clinical dental hygiene clinical career. So I decided to go, okay, let me take it back and let me start to do some pro bono work. So I just started reaching out to anyone and everything I possibly could think of to try to offer my services for free, because a lot of times these public health agencies or anything, they just don't know yet the value of what we bring to the table. So offering your services for free has been a huge added benefit for me. So at first I started to reach out to in New Mexico, because I had a really big networking in New Mexico with the developmentally disabled population. And so I helped to design and create and implement a caregiver nursing kind of oral health care program for the special needs populations within Dungarvan and within ARCA, which are these developmentally disabled agencies that care for these special needs patients. So I went and did this kind of networking within that agency, created this material, promoted this material, and then went to the New Mexico Board of Healthcare, and they ended up liking this caregiver training and started to implement this in with their special needs patients over there. So that was one thing that I did for free, got in, just networked. Then that led me to a couple more opportunities. So there was another home health agency that was looking for someone to help revamp their policies and procedures. So I ended up being able to, again, networking with somebody, able to revamp all of their policies and procedure guidelines. So that way I could kind of put in now, not only do I have that developing of a program for special needs patients, but now I also have the operating procedure and guidelines through this other home health agency. So I had that on my resume now too. And I wanted to take it even another step further. And again, New Mexico, even though I was living in Oregon, this was all remote work. I reached back out to somebody else in New Mexico who was a head and neck and lung navigator, and they worked for a Presbyterian hospital, and they were doing, they needed a lot of support with how do we manage a lot of the side effects for these patients who are going through head and neck cancer treatment. And so I helped to kind of work with that tumor board, sitting with them and kind of creating this material, that patient education material that's never been really created before, and helping really to design more of an individualized treatment plan for those patients who are going through head and neck cancer treatment. So that was another thing that I did in New Mexico. When I was now in Oregon too, I also reached out to, I saw it on like Indeed. I was just Googling on Indeed and saw something for Clackamas County Public Health Department and noticed that they were looking for, I want to say it was an intern, so somebody who was still in school, which didn't meet my criteria because I was already graduated. I was kind of overqualified, if I can say that. I was overqualified for that position, but I said, this is something I'm looking forward to getting on my resume. I think I could be a great asset to this group. So I did it for a couple months, and it was implementing a critical access care plan for patients to get emergency dental services, especially pediatric patients, to get emergency dental services, and going out into the community and finding dental providers who'd be willing to take on these patients pretty much pro bono, but we would also give them a gift of like $100 gift card or something like that through this public health agency. So it was kind of formulating and finding these dental providers who were willing to do that work, going out into the community, getting those Excel spreadsheet list of those dental providers, finding the patients of, reaching out to the local emergency departments who see these pediatric patients who are coming in for dental emergencies, and them not knowing where to send these patients. So working within the hospital setting, working within the dental clinic setting, and working within this public health agency to create this program to help with these pediatric dental emergencies. And I did that pro bono, and I found that through like Indeed. I was looking on Indeed, and that just came up. And, so what I want to say is just don't be afraid to take an opportunity, even if it's not a paid opportunity, because in the long run, now my resume was looking really great. I had, procedural guidelines that I created. I had care plans that I put together. I worked with head and neck lung patients doing oncology and patient education material. I worked within a public health agency doing roundtable discussions and all of this kind of encompass my resume now. And, still I was at that point now, and now I was having more kids. So I was not working in the dentistry um, at that time, but I was ready and prepared for when something was going to fall on my lap that I was ready to take it. Ultimately, we ended up leaving Oregon and then moving to Arizona when my young kids were, all under the age of like a couple months. So we ended up moving to Arizona. And I stayed at home for a little while with them and decided to kind of get back into the clinical dental hygiene just because that's the easiest route to get back into working part-time, which was really nice for me at that time, and worked with a really great dentist. I helped him open up his brand new practice. Uh, it was an amazing experience because it was like one of those offices that's like a unicorn office. When you find that office, you never want to leave. I just still could not have that redundancy. I just still knew that there was something more that I needed to do. So after about a year of working at that office, I decided to continue to my search for something more public health related. So I started going back onto Indeed and came across some various different things that intrigued me. One of them was an oral health analyst position that was at Maricopa County Public Health, which really was interesting to me to see kind of a different dynamic within the public health agency. And at the same time, there was also this oral health educator position for Phoenix Children's Hospital. And when I went through and looked at that job description, I didn't meet a lot of the criteria of what they were looking for. They wanted a master's level prepared dental hygienist with a master's of dental hygiene. And I didn't have a master's of dental hygiene. I had a master's in public health. They wanted somebody with pediatric experience, and I had, a few months of pediatric experience. So I didn't have like that year that they were looking for of that pediatric experience. So there's certain things that, I could have said, no, I'm not going to apply because I don't meet all of those criteria. But against all better judgment, I did. I went and applied, and I got called in for an interview. And so when I went in for that first interview, they had me meet with the chief nursing officer at the time and also the VP of professional practice. So two higher up nurses on the nursing spectrum of the hospital. Um, and they pretty much just sat me down and they said, we honestly don't even know what to even ask you because this is such a new role, and we're interested kind of to hear from you and what you think that you could bring to the table. So I had already gone and done a lot of back research. So when this role came up, I said, this looks really interesting. So I just started doing a web research and figuring out, has this been done before? Is there something similar? Has anybody else done anything like this? Just because I wanted to have in my back pocket a wealth of information that I could bring to the table. And it worked out in my favor because they had no idea that something even remotely similar was going on, which there wasn't, but there was still little bits and pieces of like consulting work that a dental hygienist has done into the intensive care units that I was able to bring to the table. So having that kind of in my back pocket was really big with me asking them questions as to when they said, what do you think you can bring to this hospital? And I said, oh, well, there's all of this stuff that's already been done. I would like to incorporate all of that as well as some of these other elements. So I think that at that time they were pretty impressed that I had already done some research on it, already knew what I was talking about it because they honestly had never heard of what a hygienist would be able to do in a hospital setting. That this role, everyone wants to always ask me, did I create this role or was it already created? It was determined from Delta Dental of Arizona. They had some community funding from their foundation, and somebody in their foundation knew of another person in Phoenix Children's Hospital's foundation. So the two of them got together and they started talking about how they could start to incorporate oral care into a hospital setting. And Delta Dental said, we don't really know what we want to do. We don't know if we want to just supply you guys oral care kits. We don't know if we want to supply an entire dental department. They didn't have the funds for that, but they were like, is that something kind of you're looking for? And so when it all was all said and done, the foundation at Phoenix Children's Hospital, because they're two separate entities. When you're talking about a foundation and when you're talking about the hospital, there's two completely separate foundations. There's the foundation who manages all of the money and all of the donations that goes through to the hospital, and the hospital just takes care of the children. So two separate entities when you're talking about that. So somebody from the hospital, Phoenix Children's Hospital, came to Phoenix Children's and reached out to the chief nursing officer and said, is there a way that you might be able to incorporate something with oral care? We have Delta Dental, who is one of our partners, who is really interested in providing some funding into this hospital, and they would like to see some oral care. So the chief nursing officer went through and she was trying to think of ways that we could do this incorporation. And she said, oh, you know what? There has been a large nationwide initiative that was brought forward by this group called the Solutions for Patient Safety. Is over like 150 children's hospitals that all come together, and their motto is to do no harm. Their mission, their values is to do no harm for all pediatric patients in the nation. So what they do is they share and collaborate together information on certain types of hospital-acquired infections, certain types of products, certain types of um, organizational guidelines or operating procedures, anything that would help to relieve patient harm. So we went and put together in our hospital with this collaboration from this Patient for Safety. And they said, we want to reduce our central line infections. So they started in 2018 to implement this oral care bundle element. And that included doing oral care. So the oral care bundle was the brushing and using an oral rinse. And so our hospital decided we want to trial that in our hospital. They piloted it on our hematology oncology bone marrow transplant unit. And we did see a reduction in our central line infections. So they decided to keep this kind of momentum going within this Solutions for Patient Safety committee. And not all of the hospitals saw great results with it. There was kind of a variation of whether or not the hospitals were compliant with it, whether or not they had certain oral care products that was beneficial for the patients. There was a lot of different variations and a lot of different data to suggest maybe it wasn't the most effective for those hospitals. So a lot of other hospitals stopped doing that pilot, whereas Phoenix Children's Hospital decided to keep it going. And so the chief nursing officer at Phoenix Children's Hospital said, you know what, we saw some good results with it. We've lowered our central line infection rates. I think we could bring in an oral health educator to kind of keep this momentum of this pilot going and keep this success of seeing these decreased central line infections and incorporating them into the hematology oncology department. So that was pretty much where that kind of role kind of came from. And they decided we're going to house that person in the education department. So it would be overseen by the VP of professional practice, and with my direct boss being either the CNO or the VP of professional practice. So pretty high up there and keeping it at level with the education of the clinical education specialists of the nurses within the hospital and the organization. So I wasn't part of like the nursing pool, and I wasn't really part of quality or infection control. I was pretty much in the education role. So now that we had this idea of where this person would be housed, what this role would kind of entail, they decided to open up the search and they put it out on Indeed. And usually, I gotta say, I think you guys all probably know, is whenever there's kind of a unicorn kind of position like this, people already have somebody in mind that they already think is going to be a great fit for this role. So they opened it up to Indeed, and I was like, oh, it's a shot in the dark that I might get this role, I might not, but I decided to apply. What was the worst that could happen? Did that first interview. The interview went great. They contacted me about 3 weeks later, and they said, oh, we would like to welcome you to our final round where we would pick the top 3 of our candidates, and we would like you to create a presentation. This presentation would be for all of the upper leadership of the hospital, which would include all of our medical directors for our intensive care units, our cardiovascular intensive care units, our hematology oncology, our bone marrow transplant. It'd be the chief nursing officer, the VP of professional practice, a couple nursing managers from different departments, a lot of upper leadership. And it would also be recorded, so that way we could send that recording over to Delta Dental of Arizona, so their entire foundation board, which is comprised of a lot of different dentists, and other people's in the community, and they would get a choice and a decision as to who they thought was going to be the best person for this role. So I went in, I put together my presentation. I had no idea. I had no idea what I was doing. I just put out exactly what I think would be what I wanted to create in this program, what the population I felt was going to be the most benefited, how I would go about doing education for patients and families and nurses and care providers and the medical team, how I would embed myself with, product and reducing infections, and just kind of gave that my all and put that out there. And a couple weeks after I did that presentation, I got word that they wanted to hire me, and they said in the process of, offering me the job, they said, it was between you and the final other two that we chose was two other dentists. And they said that it was no comparison. It was a unanimous decision among everybody in that room at the hospital and everyone in the Delta Dental of Arizona's foundation. It was a unanimous decision that they wanted me. And so I was like, I have no idea what I did, but obviously what we are known for, what we're trained for is preventative care as hygienists. And so I feel like that gives us an edge to doing these preventative programs against dentists. Dentists start talking about how they want to do restorative work and how they're going to come into that hospital and get to kind of just make a lot of different changes restoratively. Whereas as hygienists, we are so focused at that preventative level. And that's exactly what the hospital wanted to see. They wanted to see somebody who was at that preventative level that was going to make an impact and a difference, and also be able to work at that same level of the nursing, because they didn't want somebody coming in who was going to be like a doctor or anything and telling the nurses what to do. They wanted somebody who was going to be at that same kind of level to work in that multidisciplinary team and work very well. So they ended up hiring me. I ended up starting in April of 2019, and there they didn't know what to do with me. They pretty much gave me my laptop. They said, here's your laptop. We're still trying to figure out a desk space for you. And we're still trying to figure out what we want you to do, like where we want you to go, what we're going to have you do. So there was 2-day orientation to the hospital as to, the tour of, the cafeteria and the tour of the different units. And then there was, how to use the Phoenix Children's Index page and your benefits, and talking about child life and talking about all of these different, and the Patient Family Advisory Council and how, HIPAA and all of that stuff. But as far as whether or not I got a preceptor who's going to mentor me, there was nothing like that. They pretty much kind of threw me into my role and didn't even show me how to use the electronic health records. We use all scripts for our hospital, and so nobody showed me how to use that. Where most people who come into our hospital, they sit there for at least 12 weeks getting a preceptor to mentor them, so they get a chance to learn all of the ropes of the hospital, where to find the clinical skills, the guidelines, where to access all of this information and material, and then really just a buddy to kind of help them, guide them into their role. And this was very different. There was really nobody else. Luckily for me, and you'll get to meet her, I'm going to be having one of my friends who was my desk mate, who's pretty much my work wife, who is the nurse educator for the hematology oncology. She was the inpatient care educator, and then she transitioned to the outpatient educator. But she pretty much taught me everything that I know into the hospital. How did Question after question that I was asking, how do I do this? How do I access this electronic health record? How do I make these clinical documentation notes? How do I put in an IT ticket to ask for support from IT to help create some of these notes and how to use a phone and how to use a Vocera and all of this stuff. She was one of the ones who was really there to help guide me. If it wasn't for her, I probably would be lost. But so that's kind of a little bit about my background, how I got started into this role. I feel like there's so many people who always ask me, how? How do you get into this role? How are you getting paid? And a lot of people always want to know, is there the chance of getting reimbursed? And honestly, the funding aspect of it is going to come at a later time. The funding getting reimbursed right now is not going to happen anytime in the near future. I see years down the road. And I think once we start to have these hospitals kind of open their eyes and engage with us a little bit more, I feel like then they'll start to say, okay, let's start to create these codes. Let's start to hire a dental biller so that we can get some of these other people reimbursed. But at this time, we really don't have that right now. So how I was originally funded was Delta Dental of Arizona for 100% gave the full funding for my pay, for my benefits. They threw in a research assistant. They threw in some miscellaneous expenses, some conference travel. So they pretty much funded my entire position, and they said it was going to be a 2-year fully funded position. And so in that 2 years, they said, we'll reevaluate it to see if they want to continue to fund it or if they didn't want to fund it anymore. So when 2019 came around, that's when I was hired. So 2021 was when we were looking at the funding and saying, okay, does Delta Dental want to continue to fund it? And so I did show a lot of my outcome data, and I was showing patient satisfaction scores, and I was also showing, I guess, the hospital, and I didn't know it at the time, but the hospital did put out a full survey to all of the different medical teams, all the different departments, to ask whether or not my role has been beneficial in some way, shape, or form, whether or not they thought that this role should continue. And it was unanimous across the entire board, across the entire hospital, that they said, yes, this role has been extremely beneficial. They've seen such great results and they want to keep this role going. So after having all of this data, we sent it back to Delta Dental, and Delta Dental said, we're so impressed. We want to continue to fund this role. So they did another full year, 100% funded. And so then now come 22, when the funding came, Delta Dental was like, we would continue to fund it 100% still, but what we want to do is we want to start to see the hospital take some ownership in this role to make it a full-time position. So what they did is they said, well, we're going to fund it for the next 3 years at 50%. So they're asking the hospital to come in at another 50%. And so it was kind of trying to figure out where that other 50% was going to come from within the hospital. Was the hospital going to reach out to the foundation, the Phoenix Children's Foundation, to try to see if they could find another partner or another donor to equate to that other 50%? Or was the hospital going to take ownership of this role and start to embed this role as a permanent position? And it turned out everything that the hospital has seen within this role, they said, this is a role that we do see going forward and we do see keeping. So the hospital said, we're going to put it into our education budget. And so now I am 50% funded through the education team, through the education department at Phoenix Children's Hospital, and 50% from Delta Dental of Arizona. And that is going to be for the next 3 years. 3 years comes, they're going to start to reevaluate it again. And Delta Dental has already told the hospital what they're going to do is they're going to titrate it down 25%. The hospital will come in at 75%. And then however many years they decide on that, whether or not it be 2, 3 years, and then Delta Dental will come down to 0. And at that time, with the hospital already coming in at 75%, they'll just come in at that extra quarter and make it 100% full-time position. And I'm already fully embedded into the department. I'm fully embedded with all of the internal stakeholders, and everyone in the hospital already knows me. Everyone knows about this role. They see the benefits of this role. So it's honestly been a no-brainer on both sides that this role was going to continue to stay. And then every time I'm in that role, I start to think about what else can we do to advance this role? What else can we do to make a bigger impact in this hospital? And then also starting to think about how do we impact other hospitals to start to correlate what we're doing at this hospital to start to embed a role within their hospital. And so that is my goal. That is why we are trying to train all of you hygienists now, is to get you ready to answer that call when a hospital is ready at that time that they say that they're ready. And how do we embed an oral health professional, oral health specialist into our hospital, specifically oncology? That's, I see, going to be the very first kind of department that these hospitals are going to really want to embed a hygienist, especially pediatric oncology. You're going to be able to answer that call. You're going to already come in with this knowledge base. You're going to already come in confident. You're going to know what you're talking about. And not only that, but you're also going to have the ability to say, this is what's been done at other organizations. This is how they've done it, and already utilize a pathway that's already been created for you. So you're not working from the ground up. There's already something kind of in place. So that is my goal. That is what I'm hoping to achieve with this program here. I'm hoping to make you all feel confident. I hope you enjoy it. I hope I get a lot of comments, and I hope I can really help invest the future of the dental hygienists, especially you guys, into these other settings, into these hospitals, and into these oncology settings. I will look forward to speaking to you more, and I hope you learn a lot from this program. Thanks so much, guys.